Hi, welcome to Don Medical Clinic. I'm Dr. Jane. I'm going to talk to you about Healthcare Homes, which is our new program that we have available in our practice. Healthcare Homes is actually a pilot project that we are involved in. It's a federally funded national project, and currently there are 179 practices that are signed up to this program. The goal of the program is to start looking at alternative funding models in primary care and so as to achieve the quadruple aim. The quadruple aim is about enhancing your experience as a patient when dealing with your own healthcare, helping to improve the population health of our community and our society, both locally, statewide and nationally, helping to reduce costs around healthcare, and helping to improve the work-life balance of healthcare providers. It's certainly very busy at Don Medical Clinic, and I'm acutely aware that at times I don't have the time that is needed to address many of your issues. One of the things we want to try and do is spread some of that load onto other members of our team. That might involve the nurse and our reception team. We currently have a program running called the Keep Well Clinic, and many of you who have been invited to consider the Healthcare Homes model have been part of that clinic. And that clinic addresses the chronic diseases that are present in our community. And currently, the funding, as you'll see on this diagram, is through Medicare and is very item number focused. There are set criteria that we have to meet, and you always have to see one of us for something before we can charge you, and that's usually the doctor. The Healthcare Homes is a bundled payment. So if you are eligible, we then are provided with a bundled payment to help us budget as a practice with your needs paramount in delivering that care for you over the next 12 months. Medicare is our current model, and it is a fee-for-service model. It is also item number focused, and it is quite inflexible. Healthcare Homes is looking at bundled payment over a 12-month period. It's flexible. You don't always have to see the doctor. You can see the nurse, one of the reception staff, or even contact us through email and text. The amount that you might be eligible for is dependent on what criteria or tier that you might meet as part of the Healthcare Homes program. To be eligible, we have used a practice tool on our software to identify patients in our practice with chronic disease. To assess which tier, another questionnaire you will be asked to do is called the HARP tool, and that will help us define which tier of funding you would be eligible for. A nurse or a doctor will guide you through this process. Once your eligibility is determined, you are then allocated a doctor to conduct this care. At this stage, of course, that's me, because we're rolling this out in our practice with my patients to start with, to ensure that it is a useful program, and I believe it is. We really want to highlight and even strengthen what we already do, and that's providing patient-centred and collaborative care. One of the key goals of this program is to establish a program that suits your needs as an individual. A Promise 10 questionnaire is used to help us identify whether we are actually meeting your needs both physically and mentally. And it's a questionnaire that we would do on a regular basis throughout the year to see if we are progressing forward. If you're interested, reply to this email if it's been emailed to you, and then one of our staff will be in contact with you. If, however, Dr. Jane has thought, oh, you've come in to see me today, and I've wanted you to have a look at this little video, because we'll talk about it a little bit more through our consultation and hopefully have you signed up before you leave. If you're still interested, the sign-up process will involve completing a consent form, completing a Healthcare questionnaire. We will do the HARP tool questionnaire with you. We will then register you for Healthcare Homes, and we must, as part of this program, use your My Health record, which everyone in Australia now has, establish an online health summary, and that can be then linked to your nominated service providers if you have some, and that might be podiatry or optometry. Could even be the school for those people, younger patients. This summary has to be reviewed every 3 to 6 months. The bundled payment must include an annual health assessment, which I think is one of the most fantastic components of this program, because currently There are no item numbers for health assessments for those outside of 45 and 49 and those over 75. And then every 6 months we'll do the Promise 10. The evaluation of the national program, though, is essential to decide whether this program will move forward. Once you are signed up, you may be contacted by the National Healthcare Homes team to provide feedback on your experience with this program. This is important information to gather for future changes. I do think this is a worthwhile program, and I do think it's worthwhile being involved. You might ask, how will my current care change? Don Medical Clinic already works hard to offer quality, accessible, affordable, confidential and non-judgmental healthcare that is consistent and collaborative both within and outside the practice. What this program does, it allows the practice to be paid for the many jobs our staff currently do that are not remunerated. For example, email, texting, telephone calls, scripts and referral letters. For more information, please contact the clinic or have a chat to me when you see me during your consultation. I think this is a really exciting program, and I feel honoured that our practice has been eligible to be involved, and I'd really like you to join me on a journey as we start to establish some changes in a healthcare system that currently is becoming a little bit dated. Thank you for your time. Bye.